Hi, welcome to the channel. There are two best ways I would suggest anybody to use to decrease their pain quickly. Let's say you're having a pain and you want to decrease your pain quickly. You don't want to waste your time coming to the hospital. You don't want to waste your money or resources. Just two best ways. Number one of the ways is ice therapy, and I will tell you why. Ice therapy, this is a technique which we use in the physiotherapy setting, which ice treatment we put on the injury, and the eyes will block the pain signal to the brain. But this ice therapy should be used in between 28 to 48 hours, and it's not for open injury. If you're having a fracture and you're having pains, no, that is not a treatment for you. So you should go meet your doctor and they will perform some surgery if necessary if you're having a fracture. But if there is open wound, they have to stitch your wound and leave it to heal for some days and give you some medications. So that is not for ice therapy, but that is the contraindication of ice therapy. But ice therapy, if you're not having any open wound, open injury, no fracture, then you can just place the ice, and that is for 24 to 48 hours. If you're having pains, like we call that acute injury. All right, if you're not having acute injury, if you're having subacute, you can use subacute. We're talking about from 24 to 48 hours to 1 week period, 7 days. All right, so you can use ice therapy, ice pack, or if you have ice block at home, you can utilize that, like put it in a towel, wrap it, cover it, put in your pains, and keep it like for 2 to 3 minutes or 2 to 5 minutes is fine. All right, keep it, then after that you remove it. If you're feeling some burns or you're feeling some issues, then you should remember to remove it so that you will not burn your skin. And remember, if you're having infections in that area too, is a huge contraindication. Don't put in an infected area. All right, but if you're using your own at home, it's still fine, but you should just remember these contraindications. So ice therapy is very important. Now we use another thing called the heat therapy. Now the ice therapy, ice block can play the role. In the heat therapy, you can use hot stuff, like let's say you boil hot water, put your towel inside the hot water, then you can use it. Ice therapy can help in swellings too, to reduce the swellings, but hot pack, I think hot pack work more better. But in hot pack, you just same procedure and same contraindications. Open injury, red flag, don't use it. Fractures, don't use it. If you're having infections, big huge red flag, don't use hot therapy so that the infections will not spread. So what are the difference between these two ways? In the hot one causes what we call vasodilation. So in that vasodilation, what happens? The blood, like you put it in an area, then the blood supply to that area increases. Now as it increases, it's coming, like let's say there's a gunshot here, boom, or a bomb blast here, boom. Guess what? Indian army and police will hear the information, and they're coming with soldiers, they're coming with gun, they're coming with news media, they're coming with everything in their disposal to eliminate the threat. That is how our security works inside our body. So if there's a hot something here, they're coming so fast, they're coming with everything. They want to fight, they want to kill. What is happening? Let's see what is happening. Then in that case, they will start solving. Now it's like, let's say the heat you're putting to 2 to 5 minutes, you remove it, then they will now stay there, because after the police come, they will mark there, they will change there after some time, because they have to analyze everything from A to finish. All right, that is how the security in the body works. So funny. So once the security comes, they see everything in your body and they analyze it from A to finish, and even the pains which was there before, which they have neglected, or any issues that was there before, if the police have neglected, they will analyze it. Every threat must be eliminated. So in that case, your pain will be solved. That is a good technique. The ice pack way is a vasoconstriction. In that aspect, you put the ice, then the blood vessels or the blood supply to that area would stop coming. Goodness. So if you put it in an area, vasoconstriction, that place will be numb, that place will be ice. You feel how it is in your body, and the blood supplying to that area, but it is 24 to 48 hours. In the hot spark, you can use it above the 1 week period which I've spoken about, or 24 to 48 hours. But I think you should use ice pack. Ice pack is more preferable for 24 to 48 hours or to 1 week. Then above that, you should use hot pack. Alright, so you should keep this in check. So the ice pack, when you put it, there will be nothing, no blood will be coming there. I don't know if you notice, like the cups they put in the mortuary, and the everywhere is just stiff, no blood supply going forward, nothing. It's just like that. Alright, so that is how it is in the body. So once you keep it 2 to 3 minutes, alright, then you remove it. Guess what? When there is a terrorist attack in any place, like let's say insurgency take over a city, create a curfew, create anything, guess what? The police response is still same after they have gone, mostly after they have gone, because some police will just stay at mute, but if they have gone, then they will now come in. But sometimes if they are still there, they will still come in. Some few of them who are at that location will try to be the hero of the day. But most times when they have gone, especially, you see more of the policemen charging in. Open, open. Who is that? Who is that? They will start doing their investigation, and same process will bring you a healing result. So these two technique is very essential. If you have neck pain, if you have any pain in any part of the body, but when you're having pain to this is my body. This is the right side of my hand, the right breast. This is the left side of my body. This is the heart region, where the heart is mostly found. The heart is at the center of the chest, but mostly found this area. To the back area, you can put at the back, no problem. You can put at the back. I forgot how I'm using this. You can put at the back, no problem. But from this area, you should be conscious, especially to the where the blood arteries is passing through. You should be conscious of that, so that you won't damage it and you won't cause any issues to the heart. So there's a huge contraindication at the chest, in fact, chest area, huge contraindication. At the stomach, maybe you can use, there will be no much need which will make you want to use at the stomach region. But if you have any pains in the chest or the stomach, please visit your medical doctor. Don't do the practices of hot pack and say somebody told you on YouTube channel. Right? Those areas are very critical areas, very essential ones. And even in we use ice pack in the what is it called, the pubic region. I don't want to say vagina, the vaginal region. Okay, I've said it. We can use hot pack, ice pack there, not hot pack. All right, but I think in those critical areas, consult your doctor. And remember, your eye, a huge contraindication. Don't put in that area. And your back of the skull, the head, you can put at the head. You can put ice pack. All right, ice can work. You can just put for a few minutes. But hot pack, be very conscious. Most of these critical regions in our body, you should be very conscious. Thank you for watching.